This is Dr. Tiffany Lamonde from Lamonde Wellness, and today I want to talk to you a little bit about what I like to call relaxed awareness. Some people call it guided meditation, some people call it body scanning, but I also want to give you some education about two systems in the human body called the parasympathetic and the sympathetic nervous system. Now, before I get started, I want to give you a disclaimer that this is for educational and entertainment purposes only and should never be a substitute for seeking appropriate medical advice from a medical provider, given your own individual circumstances and needs. So what I want to talk about today is a little bit about two systems called your parasympathetic and your sympathetic nervous system. So I'm going to make this as simple as possible so that everyone can really understand what I'm talking about. So your sympathetic nervous system is your fight or flight nervous system. So this is the part of your body that if you were held at gunpoint and someone was going to shoot you and you got shot, you could still run to save your life. Or if you were going to be attacked by a tiger, that you would be able to run and protect yourself. Now, this system is extremely valuable and very important, but it's supposed to only be on when there's actual threat. What has happened is culturally, we have so much stress in our lives that our sympathetic nervous system is heightened, and it is causing all sorts of issues, whether it's sleep disturbances, increased cortisol levels, weight gain. The list is really extensive. And so I'm going to try and keep this fairly simple, but that system, when it's on and it should be off, it's going to make it very difficult for you to relax and do the things that you would normally do and when your parasympathetic nervous system is on. So your parasympathetic nervous system is often known as your rest and digest system. So it's when your blood flow is away from your extremities and toward your internal organs, and it helps you digest and it helps you go into a more relaxed state. This is the state that you need to go into, say, go to sleep, for example. So if you are functioning in a heightened sympathetic nervous system, then it's going to be very difficult for you to switch on to the other system. So I'm going to give you today something, like I said, there's several different names for it, but we're going to call it a body scan, or I like to call it personally, I like to call it like a relaxed awareness. So you can actually do this in any position. I think a great place for you to start is if you struggle with sleeping, of which I struggle with myself, and I don't consider my life to be particularly stressful, but for some reason I have a difficult time turning my mind off, and by not being able to turn my mind off, I have a hard time like shutting down the day and going to sleep. I work really, really hard on this, and I have made exceptional gains, and I'm very pleased with those gains. But this is one of many tools that I use for that, and in future videos we can talk about some of those other tools. So for example, if I'm laying in bed and it's the end of the day and I have already gone through all of my other sleep hygiene activities, I am going to be laying in bed and I'm going to start to scan my body either top to bottom or bottom to top, and I'm looking to relax every segment of my body. You can do this sitting, you can do this lying down, you can do this if you're starting to know that you're becoming particularly tense as a part of trying to turn on that parasympathetic nervous system when you feel that heightened sympathetic response. I see this a lot in clinic with my chronic pain patients. So whenever you are constantly in that sympathetic state, you're going to be more sensitized to painful stimulus in general. So developing the ability to switch those gears and come back to more of a parasympathetic state can also help with things like chronic pain. And I could really go into a lot of detail and a lot of research about all of this, but I'm trying to make this user-friendly for everyone. So let's start with doing it seated. So I'm sitting right now in a comfortable chair. Now I'm sitting up from the chair that I could lean back, but for the purposes of the video, I'm just going to kind of talk you through it. So for example, I'm going to start top down, and I'm going to describe what I might say to myself or what I might say to a patient when I'm teaching them how to do this. So you might start at the scalp, and what you want to think about is completely relaxing that tissue. So if you're laying down in bed, I describe it as like you're trying to melt it into the bed, or you're trying to melt your scalp off of your skull. It sounds a little bit graphic, but the visuals are really helpful for a lot of people. So you might start at your scalp and then move to your forehead forehead, particularly between the eyes, because a lot of people scowl and they carry a lot of tension there. You might think about bringing the skin around your eyes back or falling it into the bed, bringing your ears back, trying to open up, relaxing your lips so that your teeth are neither clenched nor open, that your tongue is relaxing back. You feel like the muscles of your neck are falling back, and you work that all the way down your body. I also encourage people, once they've gone all the way down their body, to kind of start over. And you're going to notice with practice, there's certain parts of your body in particular that you struggle with. So I'll give you my example. Whenever I do this and I'm in bed, I notice that as I'm going through the body scan, my lower body really isn't too bad. Although sometimes my glutes are clenched. And I can't tell you why I do this. It makes absolutely no sense. But instead of using just a top-down methodology, I'm using also a bottom-up methodology to try and create that relaxed state. So for me, where I notice it the most is when I lie down at night and I go to put my head on my pillow and I start my relaxed awareness, I'm almost holding my head off of the pillow slightly, or I'm holding my shoulders, upper shoulders particularly, off of the pillow. And so the place that I notice the greatest relaxation is in my head and shoulders, and then I think it would be followed by my glutes in particular. So when I scan from top to bottom, I come back and I do it again to see if during that time frame, if I've retensed those muscles that I struggle with. Now, sometimes you'll fall asleep before you even get to the bottom. Great, that's perfect. Or if it's during the day, and let's say you struggle with chronic neck pain or neck problems, and part of it is the tension that you hold in your shoulders. I tell patients it's like you're wearing your shoulders like earrings. So your shoulders are up here and you don't even realize it, or you're at a desk and you're sort of hunched forward in this upper crossed, flexed position all the time. So this is where you can say, okay, I'm starting to feel tense. So you can go through and you can body scan and notice where you're carrying that tension. A lot of my patients have a really difficult time identifying their painful stimulus or identifying the difference between, say, pain and injury. And that's probably a whole nother video for another day. But for this video in particular, I want to talk about that crossover between parasympathetic and sympathetic state and how you might be able to influence and turn on your parasympathetic state. And the benefits of that are, to list a few among many: increased sleep, or increased ability to fall asleep, or the ability to fall back asleep if you wake up in the night and you have difficulty with that. It can improve your digestion, and again, that's a whole nother video, but your digestion and your mental state, or cognitive brain function and digestion and your gut are so intimately related. So you can improve your digestive process, you can improve your stress response, and with that potentially help reduce maybe some of that abdominal weight around the belly because of increased cortisol levels. The benefits are really numerous. So hopefully from today's video, I've given you a tip to help you with that stress response, maybe improving some of those other health metrics that you really struggle with. And I look forward to seeing you at my next video.